Okay, welcome everyone, and welcome to virtual people in the Zoom. So this is a deep dive on the situation, the progress of WASH and healthcare facilities in Tanzania. We're going to go over some policy, some timelines and practices, some gross photos, the water and sanitation hygiene situation in healthcare facilities. I think many of you will relate to the journey Tanzania is on, how far they've come, how far the ambitious goals they've set are. And I hope you have some insights to share in the breakout groups too on how we can accelerate this transition to safe, sustainable, and also more sanitary wash facilities and healthcare settings. So until we reach safely managed. All right. So our two presenters and facilitators today are Robert G. From the government of Tanzania, the National Institute of Medical Research. He's a senior scientist with long experience in water sanitation, hygiene, and healthcare settings, and infection, pollution, and control, formerly the Infection Control Africa. And Rose Riwa, Water for People, Tanzania. She's like a one-woman team, I would say, in Tanzania. Rose does it all, influence, working with communities, advocacy, and is a program manager in the office, and seasoned public health scientist to boot too, with lots of research experience as well. So today, we'll be going over a presentation of the Tanzanian WASH and healthcare facilities roadmap, an ambitious plan first set out in 2016, kind of where we are today on that and where we have to go with massive interventions in the funding landscape, mostly through the Sustainable Rural Water Supply and Sanitation Program, SRWSS. And then how all these stakeholders, many of whom might be in the room, actually, if you can raise your hand if you're currently working in Tanzania in any capacity. Yeah. Okay, cool. Awesome. Yeah, so great to have you here. The stakeholders have really contributed a lot to this. Yeah, then I hope we'll have time for some in-depth Q&A and then breakout groups discussion. So with that, I'm going to turn it over to Robert.
Hi, everybody. Yeah, thank you. Okay, so we are here to present our progress in Tanzania, what we have done, and hoping that you will learn, that you will contribute. So I will do that. I will kind of share the timelines of what we are doing, and I will use the research results for surveys that we have done to evaluate for sharing the light on the process. So Tanzania began to work on a sector-wide approach on WASH since the middle of 2000. So the program, Water Sector Development Program, was launched in 2006, and it brought together all the key ministries and stakeholders, and we began to work on that. That was already still during the Millennium Development Goals time. And by the end of the Millennium Development Goals, the first phase one of this project had concluded, and then we were looking into the future of the same. So the preparations for the SDG started, but the program didn't pull up until 2019 because of all the changes that came in. So after beginning from 2019, we started phase two, which went over up to 2022. And now we are into phase three of the program. That will conclude next year, 2025, and then hopefully we will look into the future. So during the Millennium Development period, WASH in healthcare facility was not part of the program. But as the world awakened to the reality of the situations of WASH in healthcare facilities around the world, especially in the least developing countries, we also got involved. And the first thing that we did was to do a survey of the situation, how it was in our own situation. And so I will share a little bit of what we've seen then that triggered our action from our side. So we did a survey for 8 out of 21 regions of Tanzania. It was a cross-sectional survey, and we involved around 96 healthcare facilities, different levels. And these are some of the key results that we saw. So in terms of water supply, what we came to found was on the right-hand slide, around 60% of the healthcare facilities did not have, were not connected to the water supply lines, and therefore either they depended on on-site water supply sources, or that they had to haul water from somewhere else. And of these sources, around 20%, 1 out of 5, actually were not improved. So on the left-hand side, you had surface water sources accounting to 13%, and the 6% were shallow wells, which were not improved and therefore pretty unsafe. In terms of sanitation, we found out that around more than a quarter, 28% of the healthcare facilities, you couldn't access a toilet when you were an outpatient, and 10% of the sanitation facilities that we saw were unimproved. So these were like the traditional types of pit latrines, some of which we actually didn't expect to find in the healthcare settings, but was an eye-opening. And the other thing that really struck us was the level of environmental cleaning, which was really a neglected issue. And yeah, so that was on sanitation. And the other thing we found was in terms of hand hygiene. So about a quarter of the facilities did not have hand hygiene and washing points at the consultation rooms or even in labor areas. And again, we did testing of the surface samples, and a lot of the surfaces were contaminated by germs. And in the types of hand washing facilities that we found were mainly rudimental. More than 90% of the hand washing facilities were these temporary structures, and even if they were, or that there used to be some of the permanent structures, they were broken down, or things like of this kind. So the photo on the left-hand side shows some of the really bad examples of uncleanness in the facilities, poor maintenance, and those types of conditions, in which we could see also growth of the bugs. We also evaluated the state of governance and the capacity to deliver on WASH at these healthcare settings, and staff training was low, and there was very little planning and action on operation and maintenance. So really, there was not a lot of time or resources invested on that. The planning guideline that was available at that time was very restrictive in terms of planning for WASH services. And these results led to actions right away. So the study was completed in 2016. And by 2017, we had a guideline. So stakeholders, after we produced that report, came together and they came up with the national guideline to look into that. So the guideline outlined the planning and budgeting processes to leverage financing for WASH in the facilities. And so one of the recommendations is to increase the funding to up if possible, to 15% of the total budget of the facilities. But the guideline also put up standards for water supply, sanitation, hygiene services, cleaning and laundry, and all the other aspects of WASH, including setting up a monitoring structure for the facilities. And then that was 2017, and the Water Sector Development Program Phase 2 was launched in 2019, which then included a component financing for WASH in healthcare facilities. And there was commitment for around $11 million US for the facilities phase by phase. And the target was to reach about 2,600 healthcare facilities by 2025. So the intervention is ongoing. The second phase, phase 2, was concluded in 2022. But the third phase is up and running, which is mostly the continuation. And I will present to you another snapshot of our evaluation, of the system performance, of the financial aspect of what had happened after the intervention. So this is a 3-year financial trend analysis from 2020-2021 to fiscal year 2022-2023. So it involved primary healthcare facilities and healthcare facility management teams and council health management teams. We did this by reviewing the facility budgets, but also we extracted some of the budgeting figures from the systems. We took only a sample of the facilities for verification, but we extracted the data for all the facilities in the districts that we worked in. We also conducted interviews of the facility leaders. So around 334 primary healthcare facilities were part of this study. 6 out of the 21 Tanzania mainland regions also took part. At least 2 districts were involved by the region that participated. So these are some of the key results. So the objective, of course, was to determine 3-year budget trend. We wanted to see how we were faring, or that the healthcare facilities were faring over the 3 years of intervention. And so other objectives were there, but I wouldn't discuss here. So as you see, there was an overall and successive increase in terms of budgeting for the years of intervention. That was very clear. But on the line graph, we saw that the amount of funding that was spent, the percentage of funding spent relative to the funding actually released to the healthcare facility decreased, especially during the last year of operation, which indicated some decrease in efficiency in our system in terms of delivery. The other thing that we found was it was an advantageous period when the intervention took place, because the health sector had undergone reforms, financial reforms in these 4 blocks. So we had resorted to direct facility transfers. So all the money for the facility was transferred at this time directly to the healthcare facilities. Everything all about planning and budgeting and expenditure were done by the use of accounting systems, two accounting systems, a plan rep and facility level budgeting system was being adopted and was used. We also found that there was almost 100% usage of force account for all construction projects or projects, wash projects that had a high dollar value. And there was within this new framework in terms of management of the facilities, there was a collective structure for management of not only the finance, but the planning and management, which involved the community. So everything had to happen using a committee, and all the planning was happening in there. But the program, the water sector development program itself, was result-based financing and had its own monitoring framework. So these facilitated very much in terms of financial efficiency. However, we also realized that there was a capacity gap that could have resulted into some decrease of some level of efficiency. There was also an issue with the timing for releasing, budgeting and releasing of funds between the government vis-a-vis the project. So those were the main hindrances. So these graphs here shows the different sources of funding for WASH at the level of healthcare facilities. On the right is from at the dispensary level, health center and district hospital level. What you want to see quickly, the top bar from dispensary, we found the funding from Sustainable Rural Water Supply Sanitation Program accounted this time to 45% of all the funding that went into WASH at the level of facility, at the dispensary, but then at health center level was about a quarter of it. There was no input from this program to the district level. So that contribution is not there. The other thing that we learned through the process is the various sources that the facilities themselves use to plan for WASH in healthcare facilities, which also show an opportunity to use this for future planning. So the program is ongoing and has resulted to different level of results. These are infrastructure type of results in terms of WASH facilities, incinerators, and water treatment, wastewater treatment, etc. That's in a nutshell what we have been able to achieve, and I will invite my colleague Rosie to share with you the part of involvement of stakeholders who are very important in executing the program.
Thank you, Robert, for the nice presentation. Rosie Riwa, I'm going to take the part of the stakeholders' contribution. As we know that implementation of the water sector development program, it is done by government, but again, they can't do by themselves. It's a role of everyone to make sure that we are supporting government to reach the sustainable development goals, outcomes. So we as stakeholders, we said, we are going to work in collaboration with government. And of course, the water sector development program has 5 components. And one of the components is coordination framework, coordination with stakeholders. So we as stakeholders, we normally participate quarterly meeting to assess the progress of the program, to assess the issues of the program, but to assess on how much we can contribute, where the area that we need to contribute. How can we put our effort to make sure that we are achieving together the goals and outcomes? So there is different stakeholders, the World Bank, through the water sector development, through the sustainable rural water supply and sanitation projects, but also World Vision, Water for People, Water AIDS, different stakeholders. We are staying together in one table with government quarterly to see how much we can support the implementation of the program in alignment with SDGs goals and targets. So I'm going to just provide a small snapshot of the Water for People Tanzania, what we have done so far. This is the second year for implementation. So we are the baby of the Water for People. Water for People is operating in 10 countries, and Tanzania just established in 2022, and they happen to be the first employees, among the first employees for Tanzania. So I'll be able to show you our 2 years journey in Water for People and how much it has contributed to sustainable water sector development programs, the one that Robert was sharing. So allow me to explain more about, to just give you the key highlight of who we are. As we have said, we are a government international organization, but our focus is now to make sure that everyone, or where people can get access to safe water and sanitation services. So we are using the district-wide model or approach, whereby we implement it at the district level, but also we are also having the national level impact program that is normally implemented at the national level. And all of these things starting from the local level contribute to the national level, contribute to the global level. So in short, this is our pathway of change, starting from the local level through the district-wide approach, coming to the contributing to the national level, and then everything that we get from Tanzania, Malawi, Rwanda, and all the places that we are operating contribute to the global level. So we also have the global strategy. We call it the D30 strategy that we are aligned with. We have collaborated with the IRC WASH and the Water for Good to implement it together and to achieve together the result. You know, SDGs goals without it requires corrective action so that you can reach there. So I'll come direct to what we have done to Tanzania to support the government to attain SDG goals, and also to support the government in the implementation of water sector development program. As I have said, because we were not present in Tanzania, we wanted to know the status of the wash systems at the national level. So one among the key things we did on the initial time of our landing in Tanzania is to work with consultant and government of Tanzania to conduct the building block assessment. And we were looking for in the 9 building block assessment, and this is the tool that we are using, IRC Water for People and Water for Good, to assess the sector strength, the sector building block strength. And actually our research shows that Tanzania, we are not that much bad in terms of the washing systems in different parameters, including legal framework, policy and legal framework. Tanzania has available policies like water policy, it has healthy policy. Tanzania, it has a different legal framework, so the enabling environment is there. So you can see a green there. Then the issue of planning, as Robert mentioned, we are doing very great in terms of planning. From the lowest level goes up to the highest level. So the planning systems are well. Of course, there are some issues, but at least we are doing great in terms of planning. And other thing that we are doing great is the monitoring. For sanitation, we have the National Sanitation Management Information Systems that collect data from the lowest level at some village levels. And the data cascading goes up to the national level. So in water, we are also having RUASA, RUASA Service Delivery Management Information Systems that normally collect data from the lowest level to the highest level. In washing healthcare facility, we are having DHAS that collecting data from the dispensary, primary health care up to the national level. So those are the areas that I think we are doing great. But our interest was to see other areas that as a country, we are not doing great, and to see how much we can prioritize them as an organization, as Water for People, to make sure that we are strengthening those areas. So one among the areas that we are not doing great is the issue of financing. As Robert said, there is a lot of sector reform. There is a lot of government initiative and government effort to work on WASH financing, but the need is still there. So those are the areas that you still need more stakeholders commitment and more government commitment to make sure that we have sustainable financing systems that can make the system operate in a way that can be sustainable. But also there is the area that we are also doing, we are not doing great in the issue of infrastructure management. So the infrastructure development is somehow good, but most of the partners, government, focus more on service delivery. So there is highest investment in infrastructure development. But we think for the system to be sustainable, we need to also invest our resources in infrastructure management. And that's the thing that I think we'll have started to work with government. I will say it later in the other slides to make sure that we strengthen this parameter. We strengthen the system infrastructures management, but also learning and adaptation. You see the last slide in the presentation that Robert presented. The assessment was done on 2016. I think there is a lot of change in life now. So where is the updated data? Where can we meet and learn? Where can stakeholders meet and learn at the lowest level, at the regional level, at the national level? So that is something that also we are not doing great. But also the issue of financing water quality and sanitation, we see that most of the stakeholders and government, we put much focus in water supply. Less investment goes to sanitation. Less investment goes to O&M and sustainability, but also the issue of water quality. So I wanted to show you that we use this study to prioritize, to design our national impact program. And we use this program also to design and to establish the national WASH financing strategy. So the study informed us as a sector, as an organization, but also it has made us to have to make a case when we are attending those technical working groups, when we wanted to advocate to the government. What are the things that we wanted to advocate? What is the thing that we wanted to push forward? And after that, we have done a lot together with the Tower Summit. I can say it's a lot because it's just 2 years, but you can see later in future slide, the thing that we have done with Tanzania Water Sanitation Networks. We have done something with the alliance that we are member with. We have done something with the coalition to make sure we are jointly advocating on how best the sector can perform in sustainable manner. One among the things that we wanted to know previous when we were attending the technical working group session, sometimes CSO's contributions or stakeholder contribution were underreported. Yes, we have system to report because it is mandatory. It cannot be international angels without reporting to the government. But again, it was underreported. So there is a time that the Minister of Water asked, can somebody do the formal assessment to see the stakeholder contribution in the sector? We say, okay, we work with Tower Summit. Tower Summit is an umbrella that most of the international CSOs operating under that network. So we supported Tower Summit to do the formal CSO contribution to see, are we contributing to the thing that government is prioritizing? Are we contributing to the program that government is implementing? And the finding shows we are investing more than 400 million USD per year to support the government. And the fund distribution is like most goes to the water supply. It's 7%. And followed by water resource management. And these are the components in water sector development program. And some of it, 4% go to sanitation, 3% go to the coordination, and 0.1% goes to water quality. So you can see even the partners' interest in prioritization. Less goes to sanitation and less goes to water quality, but most of our contributions were allocated to the water supply. So this information was key because we use this one to make the policy statement for policy dialogues and forums, and to advocate not only to government, but also we as partner. Where is our focus? Are we focusing more on service delivery? Are we focusing more? Are we focused more on sustainable or maybe water quality? Because when you say safe and clean water, we cannot leave water quality behind. So it informs us as a partners, but it also informs the government in terms of their contribution, our contribution in the sector. So we also contributing to the technical and financial support at the national level. And among these things that we are doing in the technical working group or as a technical part of the implementation of the program, we have done several things, but I'm going to highlight few. In terms of water for people, since our establishment in Tanzania, we work with government to standardize asset mapping tool. This tool was not available at the national level. We did it in Mpwapwa. Mpwapwa is our EF district, where the place that we are implementing the wide district-wide approach. So we did it because we wanted to know the status of washing in Mpwapwa, but the government said it's a good thing. Why can't we replicate it? So now they asked us to provide the technical support in terms of designing it to be used by sector in the country. So the tool will be integrated in RUASA delivery model, management information system, and we are now working with them to standardize this tool and to make sure that the tool can be part of the government monitoring system. You see those parameters in building blocks in terms of monitoring. So the tool will be part of it. And we are still working with RUASA. It is an ongoing process right now. It is not yet finalized yet. But also we did assess the rural water service delivery model. We are using CBOSO, community-based water supply organization model. We wanted to know, since the establishment of RUASA, what is the performance of the model? Because for the 5 years of implementation, we wanted that information so that we can know where to prioritize, where can we strengthen the model. And the report is out, shared by the government, and the report was used to inform the ongoing Tanzania development vision. There's the ongoing Tanzania Development Vision 2050, and also the model, the report was used and presented in the technical working group, and it has been used also to inform the sector development, the program development. And we are now working with together with other stakeholders to develop the white paper for water security. Tanzania want to take water security in terms of water resource management. So those are the key things that we are doing to influence the sector. Of course, you may ask yourself, where is the washing and care facility? When we say this sector, it means that the washing and care facility is there. And in terms of sanitation, water for people, we are part of the technical team that was selected by the Ministry of Health to review the sanitation option. You know, nowadays, when the rainfall comes, it also harvesting our toilet because of the poor sanitation technology. So as a sector, we see it is important that we should sit and review the recommended national option to see whether they are climate resilient, and if they are not, then we recommend these other options that can be climate resilient. So that is what we are doing in sanitation at the national level, and I am a member of that technical committee. And also, we have participated in the development of MHH guideline to be inclusive for all people, including those who are attending washing facilities in healthcare facilities. But also, we are also working to make sure that we work with government to design the national campaign. We call it Into Niafya, campaign. I don't know how I can call it in English. Maybe Anna will help me. It's a sanitation campaign, but it includes other things like MHH, FSDM, and non-communicable diseases and washing care facilities. So it is a major sanitation campaign, and we provided the technical and financial support. So those are just a key highlight on our sector influence, but also the sector's contribution. And we hope to continue to work with government to make sure that they meet their targets. As I can say, all these things cannot be done by us alone. So we position ourselves in a way that we can collaborate with other actors such as networks. We are the member of Tower Summit, as I've said. We have done the budget analysis of 2024 to see how much the government budget is allocated and how much where is it allocated, and if the budget is timely disbursed, because having the budget is one thing, but time disbursement is another thing. So for us, we thought maybe this assessment will help to inform the sector. And of course, the report was out, and the report was used to make the policy dialogue messages, and the messages were communicated in 2 parliamentary sessions in Tanzania, the finance parliamentary session, and also the social committee parliamentary session. And actually it informed the sector, and I remember in this financial year, it was quoted in the national budget speech. So those are the things that we think if we do it, they can trigger political will, because having the budget is one thing, but utilization of that budget and timeliness of that budget is another thing. But we are also the member of Women Wash Alliance, led by now our chair is Water Aid. So if your Water Aid is here, this is yours. So we are there jointly with Water Aid, TGNP, Tanzania Gender Networks, the Medical Association, Nursing Association, to advocate in women access to wash in healthcare facilities. We speak about women, yes. We are the one who's suffering when we visit healthcare facilities, when we go for maternal and child health. So we thought instead of us, maybe Water Aid alone, going to advocate, why don't we join and advocate as jointly in terms of the investment in healthcare, washing healthcare facilities, so that it can help women to get better services during the delivery time or during the normal service time. So we are the member of that, and also we are the member of Tanzania Mwichechko region. We have done several advocacy meetings. You can see the first picture up. It was a parliamentary session where we went to advocate on MHH tax reduction and relief. We cannot pay tax for our own bread, menstrual blood. Anyway, that is another topic of another day. But those are the things that we are doing to advocate on different issues on the wash. And the good thing about this advocacy session was government removed the tax for local manufacture of sanitary pads soon after that session. And it was a quick win. There are still some issues to do, but I think our government can listen and they can act when people they are raising their voice. And most of the time when we are advocating, we make sure it is inclusive. You can see there is a student there attending the parliamentary session, advocacy session. So we are trying to work together to advocate on different issues regarding WASH. So that is just a short highlight in terms of local national impact initiative. But at the local impact initiative, also the area that we are operating, we have done several things, including direct wash investment, supporting healthcare facilities with to have the improved wash infrastructures, supporting training of the community members, training of CHWs, baby washing models. We have developed the baby washing model from Mpwapwa. We have trained the CHW to do door-to-door visit and training women with under 5 children on baby washing model. We also done a massive waste assessment status when we started our program in Mpwapwa. Mpwapwa is our EF district, and also we did the asset mapping. That is something that informed the national level. That's why they're taking to take that analysis tool to be included in one of the tools at the national level. But also, we thought it is good to have the district wash master plan. So Mpwapwa, I can say, is one among the districts, very few districts in Tanzania with a district wash master plan. It will go up to 2036. So this is a planning tool, it's a resource mobilization tool. And now this has triggered us to have the coordination framework, because it was not there previous. It used to be there, but after Ruasa, at some moment it was not active. So after this master plan, we normally meet quarterly as stakeholders, not only water for people, because now this is a government tool. We just supported the process. So it is only by the district. So we meet, we discuss, we prioritize, we plan, we do, we monitor together. So these are the things, there's something that even I can say, even the government now, they're starting to look on, to seek on our technical support to develop the national wash master plan. If the process is still there, they just ask us if we can support them to develop the TOR so that they can publicize it, or they can procure the consultant for that. So you can see that things that you can do at the local level, it can influence things at the national level. So we have done several things, because for the interest of time, I can see Anna was looking to me, but we public health experts, when you get the time to speak, we speak and speak. But I hope that is okay. And I wish to end it here for now. Anna, yeah. What do you think? Oh, you give me more time because I have a lot to speak. Okay.
Okay, thank you, Rosetta. So the national program is involving lots of stakeholders, and within the government we have the different ministries: Ministry of Water, unfortunately not here, Ministry of Education, and many other players. To conclude on this, some of the lessons that we have learned, we thought just letting the healthcare facilities themselves raising the funding for WASH may not be feasible for the time being, especially when we are building the foundation for improvement. So we think that is still a very critical aspect. The financial reforms that we have undertaken they are working very well, but they also, I think there is a need for capacity strengthening so that they can do even better. Stakeholders mobilization, I cannot speak more of that, but we also think we need to learn. So research, learning, innovation, etc. And to give you a little bit of the feel of the results that is happening in there, and to steer the discussion more, may I please play the video for you. Okay, let me see if I get it right.
Kwa kweli kabla ya mradi zahanati ilikuwa haina choo kabisa. Hii ilitupelekea hata sisi watumishi tukawa hatupendi yani kukaa kazini, hatujisikii vizuri. Kwa sababu unaangalia hata wagonjwa wanapokuwa wengi, choo cha kuingia hakipo, ndo hicho tundu moja hilo, tena ni la kijiji. Siku kukiwa na mkutano ndo wanaingia huko wananchi, wanaingia huko na wagonjwa. Kwa usiri ukakosekana kabisa.
Jengo letu la kutolea huduma lilikuwa halina sehemu za kunawia mikono, pamoja na upande wa labor ward. Choo kilikuwa hakifanyi kazi vizuri kwa sababu ya ukosefu wa maji.
Kwa hiyo kuja kujifungua unaweza kukaa hata masaa 5 mwanamke hujapata ule usafi, ule uchafu ulofanyaje ule kutoka. Kwa hiyo unalazimika ukae mpaka muda maji atakapopatikana.
Changamoto hii tulikuwa tunategemea bomba la kijiji lililoko jirani. Bomba hili linatumiwa na kijiji kizima. Kwa hiyo tulikuwa tunatoka kazini, unawahi kazini asubuhi na mapema sana, unawahi kupanga foleni ili niweze kupata maji ya kuja kutumia zahanati.
Tumeweza kuimprove kwa kiwango kikubwa. Tumepata vyoo vya kisasa ambavyo ni rafiki kwa matumizi ya makundi yote, yani wenye mahitaji maalum, watumishi na wateja wetu wanaokuja kwenye kituo chetu hapa.
Magonjwa kweli ya hasa ya kuhara, magonjwa ya typhoid yalikuwa yanaongoza sana, lakini tangu mwaka jana hata wagonjwa wanaofika OPD nao waona kesi za kuharisha zimepungua kwa asilimia kubwa.
Vile vile tumeweza kuweka mfumo wa maji safi kama mnavyoona hapo. Imetusaidia kwenye upande wa uviko 19.
Tunanawa mikono kama mimi ndivyo mashahidi, mnaona kila mahali kuna sinki, kuna maji ya kunawa. Tukishahudumia mgonjwa tunanawa mikono, kabla hatujamhudumia tunanawa mikono. Tuna karo la kunawia nje, wagonjwa nao wananawa nje.
Dada, dakika chache tu kijisikia nguvu kidogo, unapelekwa wanu, unaoga vizuri, jasiri, unabadilisha nguo, kuja hapa ni mpya. Shida ya maji kwa kweli mwanzo ilitutesa sasa, lakini tofauti sasa hivi. Sasa hivi mambo yako vizuri, pata huduma kwa wakati.
All right, so I have one question for Rose and Robert, and then we'll introduce the breakout groups where everyone can get involved. Yeah, so first, what is your one takeaway on the partnership as a government researcher and as an NGO? What have you learned from working together? And if you want to kind of come up here to answer that a little bit. And then if we can do audience questions after that.
Okay, thank you. My main takeaway is working together is wonderful. It's wonderful in a sense that sometimes if you are not working together, you may find it to duplicate resources, because sometimes government might plan, but you are also planning to go to the same areas where there are other areas which are not served, which are not saved. So working together, it can help us to have a proper plan, joint plan, to implement together the priorities that we have set together, but also resource mobilization. Because as we know, partners, some of them we are working this side, other working that side. So having the unified way of working together with government, it's good for resource mobilization, but it's also good for sustainability. Water for people may operate the 10 years or 20 years. So government are the one that will continue to.
Kuna wateja ambao tuna.
So it seems like a video I want to come again. So anyway, so I think it is it's good for sustainability. That's why in the district where we are operating, apart from the national government that I have shared, we are also doing the sustainable service checklist. We are assessing the strength of the system, but also after that one, we are working together to improve the systems, but we are working together to make sure that all our plan and everything that we are doing align with the government priorities for sustainability, but as well as for resource effective utilization of resources. And as I know, partners were here to complement what government are doing. They have the plan, they have the vision, they have the priorities, they have the everything. So our role is to make sure we are complementing what they are doing, and maybe we add the value of what the government is doing. So working together with Mr. Robert and the government has been a wonderful journey for us, and we are hoping to continue doing so as we move forward. Thank you.
Okay, can you sit on the table?
Yes, I think there is, when we work together, we deliver more. Maybe a bit slower, but we can deliver more. In terms of wash and healthcare facilities, this has been for most time the job of the government, and the healthcare facilities have been doing it by themselves. But I mean, it is evident that we are achieving much more now, when we work together as stakeholders. And so the national program, water sector development program is a multi-stakeholder from the design and even within the government. I think this program has really put all the ministries responsible from even the government itself. We are seeing the role of everyone, like us from the research side. We are also pushing the agenda by showing where the issues are. So I think it's a key issue for progress. Thank you.
Okay, do we have audience questions? Yeah.
This question is for those. Those are always wonderful to work with the government. For what challenges the organization face or the non-profit face in working for it?
So. I didn't understand.
Okay, thank you. Anything that we are doing, there is a success, but you cannot lie that you cannot find a challenge. However, when you work together, you can make it, you can find a possible solution to minimize the challenge. Mostly sometimes it depends, development partner or non-profit organization. You can't have money more than a government, right? You can have money, but I cannot have money more than what government they are having. They are collecting all the taxes, they have a lot. However, for them, they are distributed it in different areas. That way, something you can find that there is still a shortage. So one among the things that we are facing, I can say it as a partner now, is sometimes you wish to do more, but sometimes you have to pay sometimes people's per diems going to the field. And sometimes even yourself, you not have the per diem, but someone need those per diem. And if you're not paying and the World Vision is going there paying per diem, it's like government starts to learn from you because they will go to the World Vision because you're giving them a big check. So those are the things that we are facing. It is not bad to provide per diem, but sometimes it is a challenge because you cannot pay for everything that we are doing. Sometimes you need to make sure that the systems are there, it's sustainable. So we want them to make sure to know and to understand that we are doing to complement their work. So sometimes if I have cars, I have fuel, why don't we go to the field? And maybe you are not going to sleep there, we're just going and returning back. And I think maybe this, Robert, you can say something about it when you comment, because those are the things that I think we need to know that partners are contributing your work. And sometimes we would love to do a lot, but we don't have financial muscles just like you as a government. So there is a challenge, but other thing that we are facing as a challenge is the issue of the I can put it in a way that maybe it's political. I don't want to be fired when I return back to Tanzania, but political influence. We as partner, we want to be informed by the data. And you have the data. You want to go to certain village. And then you find somebody telling you, no, that council, you're supposed to distribute this 2 water project. At least it will cover 2 councils. You cannot make them going to 1 council because when you duplicate your resources, or when you do this 2 projects in 1 council, the other one you will lose a vote. So sometimes you have to use your ways. You do your things. You don't want to distort the issue, the relationship you're having with the government, but sometimes it gives a challenge in terms of the data use, because at the end of the day, we want to be informed with the data, where to prioritize our programs. And those are the things that I think we are working on. However, if you have a good relationship with the government, those are the things that it can be well handled, and actually you will meet the result together. So I would love to say all those, only those two things. Otherwise, since our establishment in Tanzania, because I was in the wash sector for a period of time, we didn't face a lot of challenges because it's like we were there. So everything is like, when we have things, we put it in the table, we discuss together, we find the solution together, then we move on together. So I hope I have answered your question. Thank you. Anna, there is another one.
If you can stand up and ask it, and then I'll repeat it into the mic. How about that? Yeah.
Yeah, my name is John Akudago and I work for Habitat for Humanity. I think this morning we learned about the 3 T's and then the imaginary T, which is the trouble one. And maybe my question is to the government representative. NGOs are usually quick fixes. They just fix the pothole and go. So could you share a little bit about the government's plan to make sure that the 3 T's, getting the transfers from the NGOs, getting the tariffs from wherever, whosoever is using the facilities, and then getting the last one, which is taxation, making sure there's enough budgets to sustain those facilities that the NGOs struggle to help you put in place with the planning. I just wanted you to share a little bit about what your government is doing on that part. Thank you.
Thank you. I was not part of the discussion that covered the 3 T's.
Oh, no, I think that was
Although,
preliminary.
I guess I have understood at least the basis for the question. Yes, on my slide, I think I portrayed at the level of healthcare facility, the different sources of funding for WASH in the healthcare facilities. So we have evaluated to see, for us to know how do the facility managers plan? Where do they allocate the funding for healthcare facilities from? And we have been able to outline so because even before this, there has been some input from the system itself. So we are planning to leverage on those. We have developed the guideline, and it provides a lot of guidance in terms of planning and budgeting. We have sustainability as a key priority now, but I think what we are looking at going towards that 2030, we feel like we need to build a very strong foundation in terms of infrastructure and capacities, and then we can be able to sustain those afterwards. As of now, we think we still need a lot of input from the sector-wide programming. And I think it is still a question to us, how much are we going to sustain that level of funding after the program? But whether we will need that much money after we have built our foundation is the thing that gives us hope. Perhaps we may not need that much amount of money once we put things in order. Thank you.
Thank you very much for the presentation. I'm Adam Goulet from PATH. I have 2 quick questions. One, I saw that the water quality we had the lowest level of investment. So what are the plans are there plans to increase that or allocate some of that, the unspent funds to that bucket, and what are those activities? And then the second is around the master wash plans for the district. Are there any talk or plans for expanding those to additional locations or geographies within the country? Thank you.
Okay, so even in the national budget, the budget for sanitation overall is less than 5% of the total water sector. Less than 5% of the total support budget from this project. And we are, it's a struggle, it's a negotiation. I think we just need to make our case, and research assessments are the things that will make it possible. But I think there is definitely bias, and yeah, we are only trying our best. I cannot say more. In terms of, so that was.
Master plan, I can take the master plan.
Okay, maybe Rose will do.
Thank you. I'll add some comments. Thank you, Robert, for a good answer. In terms of water quality, it's still an issue. It is still an issue for government. The fund allocated for water quality is less, but it's still an issue, as I've shown you there, for the CSO or stakeholders, because if you see the level of investment, then you can ask yourself, are we serious on the safety? Because our commitment is water and safety, but the level of investment can tell you that we are focusing more on water supply. We are focusing more on clean water, but we are leaving the safety behind. I can say as water for people at the district level, we worked with the Dodoma Regional Laboratory to assess different, to take water sample, more than 145 water sources. And the result was more than 30% of the sample were detected with E. coli. And after that, we take immediate action to work with the RUWASA, Rural Water Supply Agency. RUWASA, they took it because even that was shocking. And I remember one of the meeting, the district manager asked, don't present that data because it was political leader. So some of E. coli was detected in the major source of Dodoma. So how can you present that one? So after that, RUWASA he provided instruction for all CBOs to make sure that they have water quality. They have the simple water quality treatment unit. It is not that much expensive. We have that technology in Tanzania where they have it uses simple technology to treat water. So those are the things that I think government can do. It does not require too much for the simple technology for water treatment. But I think it's something that they can be done at the lowest level, because the RUWASA, they're collecting tariffs. CBOs, I mean, they're collecting tariffs. They have money, but the issue is also prioritization. Because if we prioritize, we allocate. So after that meeting, I talked to you, most of the CBOs, or if they want to expand the budget, they must write the request to the district managers to approve that budget. He will not approve it until he saw the coordination task. So I think that is the enforcement that can be done at the lowest level. But at the national level, I think even as a stakeholder, let us put more focus also in water quality issues. Because if we provide the service, then let us support the government to also to establish those sustainable ways of ensuring the waters are tested periodical, but also water treated periodical. So I think that is a key takeaway. I also have a direct answer, but we have studied something at the lowest level, and we hope maybe we can continue to advocate. That's where we are the member of Star Summit. We are the member of Women in Wash Alliance, and we hope that we can advocate jointly, because it has something to do with the political will. Politicians want to see the structure. They don't want to see other part of the structure. They want to see the structure. So it's something that we can advocate, and they're the one who make a decision of the distribution of fund. So I think that is something that we should learn together. And maybe we would like to get experience from you if you have achieved that. But it's still a challenge, and we have to work on this challenge. On the issue of master plan, of course, Mpwapwa, I can say in Tanzania, there is only like less than 10 districts, which district wash master plan. And I know Tetra Tech, the USAID project, they are also doing that in some part of Tanzania. They are still finalizing it. And we are collaborating with them and other stakeholders to make sure that we are advocating for the government to replicate this initiative to other districts. Because as for now, you can find that if you don't have master plan, everyone will come to the district with their own initiative. They don't find the ready-made plan. But if the district commissioner have the master plan, and maybe water aid is going, or maybe water for people is going, she or he will tell her, okay, this is our priority, and maybe you can support us in this area. And we think that it's something that we need to replicate. And we have started some engagement with different stakeholders, and UNICEF wants to extend in the area where they're implementing direct, and they wanted if we can share the technical aspect of it, and we did that. And we think maybe after several years, Tanzania will have some of the district with the district wash master plan. It's a good process. We have a lot to learn from this process, and the document informs us a lot in terms of planning as partner, but in terms of planning and coordination at the level of the district level. So I hope I've answered your question, and I'll be happy to share if you want to see the document. Thank you.
Okay, thank you for your questions. We have been a little long in our answers, but that is great. So now let's get to a shortened version of our breakout group discussion. So you'll find some posters along the wall with numbers on them. They correspond to these questions. Pick one of interest. And let's harvest some expertise from those in the room. Let's see if we can come up with some ideas and actionable recommendations to kind of solve some of these pressing challenges in wash and healthcare facilities. I'll read them out. First, what innovative solutions could be scaled to improve wash and healthcare facilities? We just had a long overview of so many different approaches, so let's talk about our most favorable ones. 2, how can cross-sector partnerships be strengthened for better wash outcomes? Maybe roles of government involved. 3, what role should patients, patient families, and healthcare workers play in improving wash and healthcare facilities? 4, what do wash system strengthening tools? How can they link with WashFit and support cross-sectoral strengthening? When we're talking about improving performance of wash care facilities, turning around that curve of budget spent. For those working in Tanzania, also group 5, what are we doing well? What can we do better? And what are some areas of potential partnership from those of us here? So if we want to all stand up with a lot of energy. I know it's
For
midway
Tanzania
through.
partners,
Yeah. So Robert, you're with me one here.
Okay.
Rose, you're here. Group 5. Number 1. Okay.
Okay.
Thank you. Oh, and markers. Grab those markers.
group 5.
Can you divide us?
If you can come with
Because there's no, we are just, we are not wrapping it in one.
So one says what innovative solutions could be better?
Yeah, what have you done? You know, fixing.
Yes, there is a market.
Yeah. Do you want to share?
Group 3, 1 week patients, that's before.
When you work with them, do you share?
1 week is that.
Michael.
1 group is that. One.
Group 1.
Are you talking about
So our question is for those of you in Tanzania, what are we doing well? What can we do better?
You are coordinated, so already you have plans, you are coordinated.
Okay, so. What? We
Doing well.
doing well. Maybe one point.
So yeah, so one is coordination is already perfect because the government is playing a big role. You have plans. So
Specifically, which ones are having less than
no, because the government is already beginning to roll out district-wide plan. So that is a good thing because if you enter a district, water for people look for everyone forever. So you go there, you have a plan, so you know who are the people you are looking to forever give the assignment.
Right, so what,
Are you not doing well?
what can we do better?
Okay, so can you do better? Joint programming, joint fundraising for programming.
Basic program,
No, I mean like joint.
Collaboration.
Yeah, like I mean like applying for funding.
Funding.
Yeah, funding, yeah.
okay, now I get you,
Yeah.
all resource mobilization.
Yeah, resource mobilization. Unless you have enough money for them.
No, I don't have,
It's a right one that I hear so. You give it less again.
but then it's okay. We need to do this, join with, sort here with it. They're using our friend.
Right.
So I think even now, even there's
Collaboration and joint funds. Yeah.
so I think that is.
Then the second one is, technical capacity building. Capacity building. You said two, so I'm running away before you ask us the question.
So like technical or just capacity building with
Capacity building is very important, but technical is very
even more.
because you cannot do planning
Yeah.
when you don't have the technical people who will lead you. It's like a blind person leading you.
Yeah, someone can implement.
Yeah, so somebody who knows what is needed to help you and plan everything. Capacity building in general, you can build people's capacity, but they still will not be able to put a good plan.
So technical capacity.
But you can put slash capacity building.
Possibility was in it, so.
Okay, so are we going to?
If you want to impact, you can put a slash and capacity building. Yeah, then you put capacity building. Yeah, general capacity building. I also from Tanzania.
Yeah.
Oh, so that's
I'm not sure I really watch.
what are you working?
Yeah, but I'm working with the states.
Oh, like student.
No, I know, I got a research area.
Oh, you can use it for mission. What did you do?
Water resources basically.
That's good.
So we come from all vision and she's academician, so,
Oh, yeah.
where can we, the potential, the partnership?
Oh, the partnership.
Okay, so, well, these are actually even potential areas, but, already you have this, you have, like, your capacity gaps. Okay, so you've already identified which areas are having gaps. So potential areas are already your identified gaps. So those are the potential areas for collaboration. Yeah, when, yeah. Yeah.
Okay, so I think.
Yeah, so.
For this session to see in this whether there are the areas that you think we can work together in terms of the issues identified here. For instance, the issue of planning, capacity building, and I know you're having the office in Tanzania, so is the area either raising funds together from areas jointly, or either providing the technical capacity together for the government, because I know World Vision, they are hospital.
But I don't work for World Vision. I work for Habitat.
Yeah.
But I worked for World Vision over 20 something years ago.
Used to be my.
You see that he's
Oh, no. Maybe she just wants me to still be in World Vision.
Yeah. This one, we are going to be my. Anything that you think maybe we can work together in this area so that it will be like solar. Right,
Not just collecting it, collecting.
So I think one big area that probably you struggle, potential area to would be water quality.
Yeah, that's what I'm
So, because actually a little bit of the knowledge I know, Tanzania has a little bit of fluoride issues. And so that is something that you need to do. Then another thing is research. So, because people wouldn't come to your help if you don't tell them that you have information about your individual.
We have done something, but we haven't done a lot.
Yeah, that's right. You have to you have been animal in Tanzania, so you shouldn't be afraid of any climate change.
We should be surprised.
I think I will continue. I have your help. I think I will can continue with say whether we can.
Yeah.
Fundraising. Maybe like the
I was gonna add what we can do is to have prioritization. Maybe it actually maybe that falls under water quality. I thought that was pretty important, but it wasn't very talked about obvious reasons.
Yes, yes, I know that.
So I think it would have been gap identification and prioritization. Because it's not everywhere they identify the gap. So you have to identify the gaps and then you prioritize which gaps are more important to fill.
To start with.
Yeah, to fill. So
that would be an.
no. What we can do is, because not every part of the country that you have. You may have it in the room, but you don't have it in the region. You don't have it.
Right. So I think he's saying identify those gaps.
Potential areas, the gaps you have already identified, those are already there, so you can start making their potential. But other areas where you do not get identified, it is good to identify those gaps and then prioritize them. Which one is better? Is it training nurses about healthcare wash related issues, or is it the cleaners training them what to do, how to disinfect, and so on? So you have to identify the gaps.
It doesn't go where it's supposed to go.
So when you
Just go to its management. That is another problem.
They use an extent, they have a hospital, so there's no excuse of disseminating those data in a way that it's easy to just to produce much information.
People have only one language now. So Tanzania is the most interesting country to live in because most people live.
Yeah.
Others in the- they-
Some of them they are in English, some of them they are in Swahili, instead of the Indians. Yeah, when they use in Swahili or in English, the problem is for me, I would recommend, for something that we are doing in international organization, if we have a policy or we have strategy, it is mandatory.
So that is something you can do better. Make it, make it like simplifying guidelines and dissemination. Four. Yeah, simplify. Yeah, simplify, FY, okay. Okay, simplify guidelines and then dissemination.
Yeah, because I was thinking if the IT people from the government can make a short module for guidelines, and because most of our healthcare facilities, they have not targeted computers for that application, so they can access this devices. So if they can access this devices, having those short courses, I'll show you. The way we are reading, maybe I say policies. That can make somebody. How much age to complete, and if you finish,
We're too good. Yeah, because again, in the US, they do that. They're going through the movers, I think they will demand, you can't, you have to do that. Something. Do anything else. So.
And we also have the mandatory tools. If you don't get, you don't do it, you get the trouble. So I think maybe having that system, it's a plenty of reading. Sometimes people they don't do it.
I would not work in a government sector. You know why? Not everybody who is there's no motivation to even know the thing.
Like you wanting to do it.
Yeah. Right now, you are motivated to do a program because it will help you get promotion, it will help you get salary, it will help you move to the next level. Tell me a lady who is in maybe a rural area in Kilimanjaro has gotten a job with a local and you are forcing her not to get an index of my life, but she can move to the home. But it's a cleaner. Yeah, janitor. And you're forcing her if she doesn't complete. She's fired. Especially if the course of money she has to write. You're going to look for another small person. Yeah, you fire her for that. So when you simplify, put them in the tutorial. It is just like the airport. It's not everybody who speaks English. But whether you are Russian or English, there is something that will guide you where to get. So, yeah, just put them there, and then if this unit is about cleaning, they put a little bit about cleaning there. Maybe how to bend down, how to lift the weight, how to do this. Yeah, so make it the way people can understand, because Africa is still the most uneducated population you can ever be. Especially those who are in their 30s, 40s now, they didn't get a chance, and you cannot force them to take a program, or otherwise you fire them. You'll be troubling families.
Like in talking about.
You shall see.
Yeah, like that's what we're doing with the slash.
Yeah.
Yes. In schools, they use it in school. And, that is even the yeah. Every time when you see, you remember, it keeps getting it. Yeah.
So that should be, just simplify it. You know, if they say, when you come to the hospital, first of all, when you come out of the hospital and you are going, wash your hands. Then the person is just coming out of the door, puts hand washing by that person. Then say if the person is going into the room, you need to wipe your legs on the carpet. So then you put somebody now going, so you do your feet like this before you put the person walking in. Then they see, it gets. You are giving them a PhD to write by going to do this program. They would all leave the hospital, and then now the nurses will take care of patients.
Yeah, sure. I'm here too. However, something that's like, for those who can still in, maybe we can have a simple pictorial ways, so that when somebody, maybe only 5 minutes, somebody maybe she's testing, looking for Twitter, Instagram, and Facebook. She can have, and when you finish this certificate, maybe your supervisor can put away voice me where my supervisor can make sure that the staff have done it.
If you want to really train them, and you have money, and you see they are coming for a year, they will sit down 5 days and listen. But if you put this at the hospital and tell them to do a course, Rose, I'm sure when you were doing your DRI course, there were your colleagues who struggled to submit their papers. Even though you were going to get a certificate, you are educated, you know the benefits. So when people are not educated, there's no incentive.
I think you said something about motivation.
Do we need to switch every morning? Oh.
Yeah, I was saying about the motivation. To do what's good for them, you know, it's like they're motivated, there's no reason. Besides, they go eventually will get into that.
Now, you are busy, right? I'm also busy. We are all here, not because we like food. We are motivated for 2 things: the dollar and the freedom that you have to be who you want to be. I want to be my father, mother, my friends, their fishing, their food at home, and then I'll be your father. So we are motivated on the dollar and the freedom to be who you want to be. So that is. Put the same dollar, put the same freedom, you get it? So people don't have the motivation to do this. The government officials, as soon as they enter the job, they never learn how to read the right way. Because there's no motivation. Your salary is never paid to what you do.
Hello, may I request your attention? Are you done? Are we all done? So. Hello. Okay, I would like to take this opportunity to thank everyone for attending our session, and we really appreciate your time, and we really appreciate your inputs. We are going to use the input you provided for us to elaborate our county program and our way we're influencing government. So thank you, everyone. I know the time is not in our side. Let us continue to connect as we move forward. Thank you.
Thank you. We can.
It's very funny, but can you take a photo for me and just?
I'll do photos.
And then.
Don't worry. Yeah,
No.
that's right, it's 3 o'clock. Yeah.
Thank you very much. Robert, we use your phone, right?
Yeah.
You can give it to Robert, then
I want to pretend to be supporting him.
You're not supporting, you're supporting, you have been supporting me